Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Friday, August 28, 2026, episode 115. Today, the money and the machinery both move inside rich country public systems. A federal health agency putting up to $175 million US into robots that could deliver stroke care where no surgeon lives. 4 states testing bank-style transaction blocking on food benefit cards. And Japan riding AI into the emergency call itself with a 2030 date attached. We start in the United States, where the Advanced Research Projects Agency for Health announced on August 21 that it is committing up to $175.3 million US over 5 years to its Autonomous Interventions and Robotics program, led by Elina Hanku.
What makes this significant is the access gap it targets. About 335,000 people in the United States are eligible each year for mechanical thrombectomy, the procedure that physically pulls a clot out of the brain during a stroke. Roughly 12% of them get it in time.
MedTech Dive reports the split. Philips North America up to $33.7 million US, Siemens Healthineers up to $31.1 million plus a $5.4 million company contribution, and Magnendo up to $32 million, with the rest going to a Massachusetts Institute of Technology spin-out and the University of California, San Diego. Stryker sits under the Siemens Award as a subrecipient.
The model is the easy part. The binding constraint here is staffing geography. More than half the United States population lives more than an hour from a hospital that can perform the procedure, and the limit is the number of trained interventionalists.
Philips filled in its own detail on August 26. That work runs with Johns Hopkins University, Boston University, and Dr. Jay Mako of Weill Cornell Medicine, building on the Azurian image-guided therapy platform toward remote-assisted and progressively automated procedures.
For practitioners, that reframes a stroke as a distribution problem, and the thing that has to sit near a patient stops being a specialist and becomes a suite. 5 funded teams now have 5 years and published milestones. The first checkable claim is whether any of them demonstrates a remote-assisted procedure on a human patient inside the award period.
Second signal, benefits integrity. State Scoop reported on August 27 that the Aspen Institute's financial security program, working with Propel and JP Morgan Chase, is piloting real-time transaction blocking inside the payment authorization flow with 4 state benefits agencies.
What makes this significant is where the defense sits. The tool flags a suspicious purchase and temporarily blocks it, the way a card issuer does, instead of paying a claim back afterwards. The federal reimbursement route for stolen food benefits lapsed, so households have been absorbing the loss directly.
The numbers are specific. 18% of benefit cardholders reported stolen benefits in the previous year, about $607 million US in total, with some households losing more than $500 at once. More than half of theft victims skipped or reduced meals afterward, and 35% struggled to pay bills or rent.
The pilot runs 12 to 18 months, with a launch stated for the summer of 2027.
Story 3, Japan. The Japan Times reports today that the Fire and Disaster Management Agency will launch a model project in fiscal 2027 to use AI in handling 119 calls, the number that covers firefighting, rescue, and ambulance dispatch.
For practitioners, the design is the interesting part. It starts with speech recognition that transcribes the call automatically, so an operator is not typing while triaging, and adds a function that suggests the actions a given call requires. The same approach is going to the 7119 line, the service that advises callers whether they need an ambulance at all.
The roadmap goes further than assistance. Citing severe labor shortages in the firefighting sector, the plan lays out an automated AI response system for 119 calls by 2030. The agency names its own unresolved problems: voice recognition errors, behavior during communication failures, and accuracy with elderly callers and callers speaking a foreign language.
That is the governance line, and it is unusual to see it drawn before the build. Every deployment in this space so far has been municipal and non-emergency, including the Massachusetts non-emergency line we covered on August 25. Japan has put a country-level timetable on a life-threatening call, and the fiscal 2027 model project is when those named failure modes become checkable.
Story 4, Ghana. Tech Review Africa reported on August 27 that the Responsible AI Lab at Kwame Nkrumah University of Science and Technology in Kumasi has built SignTalk, a tool that translates Ghanaian Sign Language to text and back through an avatar, using a plain webcam and no specialized hardware.
What makes this significant is the corpus behind it, not the avatar. The lab says its second phase built a video dataset of more than 3,000 Ghanaian Sign Language signs specific to healthcare interactions, with a paper published in Scientific Reports. Sign language translation fails on domain vocabulary, so the healthcare dataset is the expensive part, and publishing its size makes the approach replicable for other national sign languages.
The same lab has 3 more assistive tools in development: a service that lets deaf users place phone calls independently, a sensor-equipped cane that gives audio feedback in local languages, and an AI-driven hearing aid. Prototype testing sessions ran alongside persons with disabilities rather than after the fact.
The human consequence is plain. A deaf patient in Ghana today typically brings a hearing relative into the consulting room, which means there is no such thing as a confidential diagnosis. No deployment count and no funding figure has been named yet, so the next checkable milestone is the first clinic.
Story 5, and a caveat travels with it. Audio-I, a company that sells accessibility software, released United Kingdom findings on August 27 from a scan of more than 14,400 pages across 7 industries. 89% of those pages carried at least 10 accessibility issues, at an average of 66 issues per page.
Exactly, and that commercial interest is worth holding in view while reading it. What matters operationally is the concentration. The issues cluster on interior pages, product listings, booking forms, service pages, and not on the home page anybody audited.
The company's separate accessibility index, published earlier this year, reported that 95% of AI search traffic bypasses the home page entirely, and that pages beyond the home page average 10% more accessibility issues and 18% more page elements. 2 studies, 2 datelines.
This is where the field reality matters. Accessibility budgets went to the front door because the front door took the traffic, and an assistant that answers a question by linking straight to a booking form routes a disabled user past the one-page anyone remediate. Audio-I reports deeper pages already appeared in roughly 60% of accessibility claims filed in 2025. And the open question is whether a non-vendor scan reproduces that interior page skew.
On the disaster watch, flash flooding on Nepal's Boat Koshi is under an orange alert on the Global Disaster Alert feed, whose August 28 update records 527 deaths, while press tallies the same day ran lower. Flooding in India has displaced 240,070 people, flooding in China 87,168. The United States Geological Survey lists a magnitude 6.0 earthquake offshore north of Kalula, Somalia, on August 27 with no reported casualties. And Tropical Cyclone Sodal is running over Japan, China, and the Northern Mariana Islands at winds up to 213 kilometers per hour.
One of those connects straight to today's Japan story. Sodal is tracking over Japan right now, and degraded communications is one of the 3 failure modes the Fire and Disaster Management Agency wrote into its own plan. A storm is exactly when emergency call volume spikes and the network is least reliable.
Funding watch? The Adaptation Fund Climate Innovation Accelerator, run through the World Food Programme's Innovation Accelerator, is open for up to $150,000 US in technical assistance per project. The deadline is September 6, 2026. 10 to 12 candidates are selected in November, with an innovation bootcamp in January 2027.
The eligibility line is the real filter, and it is geographic. An applicant has to be a legally registered entity with a presence or a willingness to build one in the Dominican Republic, El Salvador, or Peru. The themes run wide: early warning systems, climate information, disaster risk management, water, and post-harvest losses, so the fit is narrower than the theme list suggests.
The through line today is that the money and the machinery are both moving inside rich country public systems. Federal research funding aimed at stroke care deserts, benefit cards getting bank-grade defenses, and a national fire agency putting a date on automated emergency calls.
And each of those published something checkable before deployment. Japan published its failure modes. The Benefits Pilot published its 2027 launch date. The Ghana Lab published its dataset size and its paper. Those are the claims a year from now can be measured against.
That's Impact Signals for Friday, August 28, 2026. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.